So after the day duty, I have to stay for the night as well in the ward, and after a general round in the night and ensuring everyone is fine, I went to sleep. At around 2:30 in the morning, the nursing officer knocked at my door like thug 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 thug, sir, come out, and I came out like, what happened? And they told me a patient is getting sick, please come fast. As soon as I reached there, the patient was lying on her bed and was looking confused. And their attendant told me that they took the patient in the toilet where she kind of got unconscious. Now this is a very short history, but there are three things that I was aware of. Number one, the patient had episodes of hypocalcemic tetanic events. And number two, we are here in a nephrology ward where everyone is having some or the other pathology of kidneys. Lastly, the most important thing, there is no consultant over here and there is no time to wait for him. So I had to take charge of the case and I had to act fast. So when the nursing staff was taking vitals, I went and started preparing the heparinized syringe for ABG. In cases of emergencies, ABG is hands down the best blood investigation that can be done, because number one, it's quickest, and number two, you're not only getting the pH level or the partial pressure of oxygen or carbon dioxide, but also you get the serum electrolyte levels. The reason why I was interested in serum electrolyte level of this patient was because number one, she had a history of hypocalcemic events, and number two, it's a nephrology ward. Every patient will have a deranged electrolyte level. So the vitals came, the BP was 125/89 and the oxygen saturation was 98 to 99% on oxygen mask. So after looking at the blood pressure, one thing was sure, that patient is not in any kind of hypovolemic shock, and neither did the patient need any IV fluids rush. So quickly I took the ABG and sent it for the investigation. Meanwhile, the patient started getting oriented about the surroundings, and I tried to communicate with her, and she was able to follow the commands and communicate with me, which obviously gave us some time for further management, and we waited for the ABG report. And soon after, ABG reports came, and you can have a look at the ABG report yourself. The patient was severely hyponatremic. So one thing was sure, ki sodium needs to be administered. And thankfully 2 days before, I read about the treatment of sodium deficit, and at that time I wrote it in my pocket diary, and this is the time it came to use. And in cases like this where there is severe hyponatremia, treatment should be started as soon as possible, because patient can get into fatal seizures otherwise. So I informed over text my consultant that I am going to start this treatment, and we went with it. But look how we write advices on the procedure notes of any patient. All the upcoming interns, you should also take note of the formula that I used, and this is the picture of the note. Also read it from any serum electrolyte chapter of yours, from any kind of source. I used Deepak Marwa sir's notes, and that was very useful for me, and all of you are smart enough to understand whatever it's written over here. In the morning, consultant called me to ask about the update of the patient, and the patient was doing fine, and 3% NS was still going on. And he told me it was a case of post-hemodialysis disequilibrium, which happens after dialysis. It's kind of a side effect, but a rare event where there is so much disequilibrium in the body fluid that cerebral edema starts to occur. And in this case, you can see in the ABG report, the sodium level was very low, so the osmolality of the plasma was decreased, and that's the reason why cerebral edema started to happen. And for the further management, my consultant told me that 3% NS was fine, but if the symptoms still persist, start with mannitol to obviously decrease the cerebral edema part. And after the 3% NS was completely infused, the patient was all fine, and after half an hour, I took the blood sample for serum electrolyte profile and sent it in the lab. So now that I think what could have happened during the night when she went to the washroom, it can be possibly a minor episode of seizure. Well, that's possible, or some kind of unconsciousness can also happen, some kind of convulsion can also be there. Well, basically it was some neurological deficit. So that was the story. I forgot to introduce myself. Hi everyone, I am Dr. Tavish Pandit. Currently I am doing my internship in AIIMS Bathinda, and this is my YouTube channel. And the reason why I told this story was because it is one among the several stories you or the future interns will also have to face or have to see. So there are just few points that I want to tell you. Ki it's okay if you don't know the stuff, you can always ask your seniors, but sometimes you have to take the charge. For that you need to prepare something. So I knew it that my duty is going on in a nephrology ward, and anything can happen, and I should know the basic management. So I read the serum electrolyte chapter once again, and that's the only reason why I happen to know this deficit treatment, sodium deficit treatment. So it's okay, no one knows. Like I have studied it a year ago, but obviously किसी को याद नहीं रहता है for the long term, so you have to revise again and again. So whichever department you go in, revise it during that rotation only, and prepare that, at least be good in that subject that you are doing your internship in. And it also increases your retention memory for that topic that you have read and that you have applied later on. So like this sodium deficit treatment, I don't think I'm going to forget it anytime soon. So that was it for the video, guys. Thanks for watching. If you want to connect with me, you can follow me on Instagram, and you can join my Telegram channel as well. And if you want to join this community, subscribe to the channel, hit the bell notification, and I'll see you in the next one. Bye bye, take care. And if you want me to explain the calculation how I did it, you can drop down in the comments. I'll be always available for you guys. Take care. Bye. See you. Keep grinding, and I'll see you in the next one.